Hi, I'm Micah, and I just wanted to talk a little bit about informed choice and our right to refusal. So, in a hospital setting, in a home birth setting, with a midwife, anywhere that you decide that a woman decides that she's going to have birth, she actually has the right to choose what happens in her birth. This number one means that we have the right for informed choice. So, we have the right to ask for information about what is being asked. So, if a woman is being told that she needs to be induced, if a woman is being told that she needs her waters broke, we have the right to say, why? Why? Tell me why. So this is informed choice. It means that we have the right to ask about the research behind it, why people would want to make this decision. Why should I make this decision? What are the other options? We have the right to all the information before we make a choice. And then we also have the right to refusal. So as a woman, you are not forced to do anything that you do not want to do in your own labor. So you do have the right to informed refusal and you have the right to consent. So this means that you are able to say, I do consent and I do not consent, which is how we refuse a service that we don't like. The power that we have going into our own birth and into a birth that we're helping is education. So the more that you know, the more that you're prepared about what could happen in your own birth, the more that you know what these procedures are, the possibility that they're going to be presented, and that you have the ability to say no, then you have more power. So really informed choice is about you having the information about the birthing process and what might happen in your own birthing process so that you can go in prepared to navigate the choices that are going to present to you possibly. Also, we do have this little helpful tool when we get into a decision-making process called brand or brain. So they're a little bit different, but brand is what we want to ask ourselves when we're confronted with a choice. So first, what are the benefits? Are there benefits to this? What are those? What are the risks? Are there risks associated with this procedure, and what are those? And then we want to know our alternatives. What are the alternative options in this situation? Maybe the alternative is just waiting, but there are always alternatives usually. So know those. And then in brand, we do nothing. We just wait a moment. We take a breath. We let all that information sit and percolate. You know, we feel the benefits, the risks, the alternatives, and then we do nothing. Then we make a decision. The other way you could look at this is brain, so benefits, risks, alternatives, intuition, and then nothing. So we want to bring our intuition into this process. We always have a little time to make a decision. So another big thing that you can always ask a provider is, can I have some time to think this over? And that will just give you some time. We need some time to think this over. You don't even have to ask for it. I need some time to think this over. And that gives you a little bit of time, a little space from the provider. It gets them out of the room so that you have a moment to digest, to get back into your sovereignty. Because what we want here is to empower every woman to have the birth that she wants. And with informed consent, with our right for choice, with right to refuse, we actually can have an empowered birth, knowing that we have the right to ask for skin to skin, to not put a hat on our baby, to say no to an epidural, to see that nurse about to break the water and say, no, thank you, you need to leave. So I do not consent is our right to refuse. And as a woman having a baby, every woman has the right to informed choice, to know her choices, to make informed decisions, and to say no.